anything and everything regarding pregnancy, parenting, any questions on usage of any baby products, and I am here to answer this from Monday to Friday at 10:30 to 11. So we know that a lot of buzz is happening around summers. The kids are not doing well. Schools have started. Parents have a very, very different query on understanding how do I send my school? What do I take? What do I do to take care of my skin during summers? What if things happen in this way? Things happen in that way. So there is an amazing set of questions which has just come up, and I would be taking it one by one. Okay, to begin with is the first part of it. Let us understand that in summers, for babies it becomes extremely difficult at a given point of time, that they are not able to feed by themselves, or the quantity is low, or they have a lot of constipation issues. But why does this happen? Okay, so a mother has you asked me that my baby is 6 months old, and it is quite hot in the place where I live. Can I start giving the baby water? Well, definitely, mom, you can start giving baby water with the help of a dropper. And now you can start giving it in like 20 ml. Okay, so 20 ml would be around 4 to 5 spoons, which you can initially begin with. And when should be you give this? You should give this after the feed. Why? Because it helps the baby settle down on whatever feed the baby has had. At a given point of time, you may understand that you start introducing small items of food, like you are giving rice water, dal water. You're also giving coconut water at point of time. So when you are experimenting with the baby's food habits, you also have to ensure that you start giving water, and it becomes very, very pleasantry for the child to start tasting water. Now we all know that there is a guideline given by the WHO. WHO is the World Health Organization. They say that 6 months it is exclusively breastfeeding. When we are talking of exclusive breastfeeding, we don't introduce water. So water acceptance is also a little difficult part on most of the kids, because it has no taste. Okay, and if the child is liking or not liking, the child may not be able to express it. So, on a regular basis, after 6 months, you start giving little quantity, and probably that will help your child to settle down. This also makes me answer another question, which is from a new mother. She says, my baby is around 3 months old, and I am breastfeeding him as per his routine. But I'm not very sure if the breastfeed is sufficient for him, as his weight looks fine, but he always gets hiccup after the feed. So now in this question, I would like to say that mom, you're doing a wonderful job. This is because you're feeding your child as per demand. That is a very good thing. Second thing is, hiccups are a very common part of the child's routine, because air is sometimes getting sucked too much, and the baby is not able to, push that out. So, as a part of the routine, it is very common. Over here, the trick is that when you're feeding your child and when the hiccups start, you can just wait for a minute, keep the feeding on hold, hold your baby in an upright position, and on the back, you can just do a little hand massage, which will enable for the air to come out. This is also a technique of burping. Now, what happens over here when the air is inside the food pipe or the windpipe? It gets removed because we are pressing the baby against our chest. And in this manner, the baby is again in a little relief, and then he will be able to take a good quantity of milk when you put him at breast. Isn't that wonderful? So, this answers your next question. I have another mom who is asking me, I have been feeding my child, but at a given point of time, I get really very tired. I do agree. It is a very, very energy spending task. So the mom is asking, can I use a breast pump? If yes, which one? Should it be a manual one, or should it be a electric one? Well, mom, you're doing a wonderful job. I do understand that you might have less sleep, you might have low energy, but breast feeding pumps are always helpful for you in a way when you are sick, when you are not well, or when you are about to resume for work. Okay, now whether it is electric or manual, we always have to understand that safety of the breast is important. First thing. Second thing, the breast pump should be cleaned hygienically, because every time you're using it, the flange is the size of the pump which gets fitted on the breast. That has to be clean. If it is not clean, then there is a lot of risk of infection. Third thing is, when you are doing a bottle feed, when you are doing a breastfeed pumping, you are removing it in the bottle, and probably your child has been on breastfeeding so far and then moving to bottle feeding. So that is going to confuse the child on to understanding how fast should I take the milk. So there are three advantages and disadvantages which I just discussed with you. Now, when we are talking about manual pump, it is very safe. It requires a lot of energy, yes, but it is safe to use it because the flow at which the milk comes is consistent. Infection rate is very low, nipple damage is almost zero, and the baby, it is not really confused when you are switching it from a breast to a bottle. Whereas in electric pumps, first thing is cost. It is extremely costly. It's a one-time investment. Third, cleaning requires a lot of sterilization equipments. Okay, and when you have the pressure, the electric sense, pulse, at a given point of time, if the chest is unable to hold on to it, then it goes a little difficult. Plus, the infection rate goes very high. You get cracked nipples, sore nipples, and the healing process takes a longer time. So, it is definitely on your side to take into consideration about how much you're going to spend, how much time are you willing to spend. Everything has a disadvantage and the advantage. Look for it, and then definitely you will be able to take a right decision. I have another question. It says that, can I give milk of magnesia to my 1 month, 15 days old baby? Now, milk of magnesia is something which is always has to be given by the doctor's recommendation. One thing, it is not necessary to give it every time when you're feeding the child. And ideally, it is not recommended for a very small age baby. When you are breastfeeding, you have to ensure that you are eating very well and a very healthy and a nutritious meal, which is basically a home cooked meal. If not home cooked, then you are dependent on somebody who is going to provide you with meals, which is hygienically safe, and it should be nutritious, because this is ultimately going to help you to increase the milk production in your body. Second thing is, milk of magnesia might have an adverse effect on the digestion aspect of the child. So, for a 45-day child, it is not really advised, and the thought should be removed from your mind at this point of time. Now, can I give Cerelac to a 4-month-old baby? Cerelac is something which is, a complementary food which we have to introduce. But at the age of 4 months, it becomes difficult for a child to digest, as his digestion is not yet developed. Anything outside, any food which you want to introduce, ensure that it is done only after the age of 6 months. Cerelacs can be made in two form, so you still have a good time to prepare a homemade Cerelac. Keep it safe, and when your child is almost 6 months, you can start introducing Cerelac at that point of time. The next question asked by the user is, my can I drink cow milk? Now, you are a mom. Definitely, you are doing a wonderful job feeding your child. Why shouldn't you not have cow milk? Cow milk is healthy. Cow milk has good, proteins. Cow milk has good fats. And second part is, it's just easily digestible. If you feel that you're lacking energy and if you feel your milk production is low, definitely that is a good source of protein to begin with. Now, how to have it? Either you can have a little dry fruits in it, either you can have a little kesar in it, or either you can put a little bit of haldi in it. It is best you have it without sugar because natural taste is much better for your health. So in these three ways, you can definitely enjoy your cow milk. And now, since it is cold, it is hot, so cold milk will be also preferable. It will not cause any gas problem, or it is not going to be, problematic for you. So don't worry so much. Our next question by the user, it says, "Hello, I had a C section 2 months back. My body is paining daily, especially legs and head, having a white vaginal discharge, and sometimes light pain in the abdominal and the scars. I am worried. Please suggest me something." Hello, mom. You are going through a change of, body in your post pregnancy lifestyle. You need to understand these pains will be a common routine till the time you are feeding your child. Ensure that you are drinking enough of water. Now, what happens over here is because of summers, our body tends to get dehydrated. As in, there is a low amount of water which is taken up. We are also feeding our child. So ideally, we should take around 1 to 2 liters. But when we are feeding our child, we have to take care that we feed our child also very well. So your water intake has to increase to 3 to 4 liters. Now, leg cramps, headaches, abdominal pain would all go away if you increase the liquid intake. Now, liquid intake can be defined into various ways. It could be, water. It could be coconut water. It could be buttermilk. It could be sugarcane juice, which is all natural. Anything which is, homemade is safe for yourself. Try and keep some, gaps in between your meals, and you only give yourself these liquids. Definitely you will see a rise in your energy levels. All your cramps will go away. And if you are having a little abdominal cramp, what I would suggest you is that you can take a hot water bag and get yourself some rest when the baby is asleep. These pains could be carried on for another month or so till your body settles down internally. It is not very easy to understand that why these things are happening. But yes, the body has definitely transformed in, and still your body is settling down. So without any stress, I would ask you to rest when you get maximum rest, and stop worrying about why these things are happening. I hope that answers your question. Our next question for the day is, after C-section delivery, my bleeding has stopped in 7 days. Is there any problem? Well, now definitely if your hemoglobin has been low, on a lower side, which has been between 6 to 8 or 8 to 9 or 10, and definitely if your delivery was a success, your bleeding could stop immediately within a week's time. But this can restart. Now, how? Once there, it is a cycle that you need to understand that when you're breastfeeding your child, your hormones are at play. When your hormones are at play, you have to understand that these things can be up and down, and definitely it is going to affect your bleeding cycle. It is stopped. Probably the hormones are at rest. When they get activated, the bleeding would start again. So you may not be very sure that it is temporary or permanent. Keep a watch. If it starts, do consult your gynac onto what care to be taken. But if you feel that there has been a gap of 1.5 month, and you are worried, probably your estrogen levels have gone down, which may not, help you to start with your menstrual cycle again. At this point of time, you can always go back to your gynecologist and tell her that this has been a problem and what would be the probable solution. I hope it has helped you to understand all this. My next question by the user is, Hi, my baby is 4 months old. At night, she is sleeping completely on her tummy and head on one side. Is it safe if I keep changing her position, that is on her back, and she is not sleeping when she is not sleeping? She cries a lot. Is it safe to make her sleep on her tummy at night? Please answer. See, by the month of 4, your baby has attained a very unique kind of a sense and a routine for themselves. So need not be worried. Second thing, you tossing the baby might disturb the baby's sleep routine. Okay. Third thing is, if the baby has fallen asleep on its own, then it is fine to let the baby sleep on the tummy and not on the back. But if you have made the baby sleep, okay, you can put the baby either on the right side or the left side. And this will definitely help the baby to have a better sleeping position. But if the baby alters the position on its own and later falls back to tummy, please do not disturb the routine because they require a comfort which they are looking for. So definitely it is safe. Only ensure that there is no pillow beneath the head, and when she is putting her face on the side, the nose area is completely cleared off because at a given point of time the child might get suffocated if there are too many things under the head. So just ensure that they are completely free and they don't get shortened of breath. That's what I can help you with. I hope this helps you to understand why is it important to make the baby fall asleep on their own. My next question is, hi moms, I have a problem with my baby. When I make her sleep on her back, she gradually moves on her tummy and she cries a lot. What do I do? This has been happening during the daytime a lot. Okay. I just explained that tossing the child for sleep is not really something which we should disturb the child's routine. They are setting up themselves in a way that which is comfortable for them. Now, in the night, there was a situation we just spoke a few seconds back. Now, the situation is during the day. So, whether you are using a swing, whether you're putting them on the bed, whether you're using a rocker, whether you're using a car seat, wherever you're placing the baby, ensure that the child's head, neck, and back posture needs to be aligned to the bedding pattern that you're using. It is because these three things are having a posture problem. If at this stage it is not kept properly, then the child may have a posture defect. Secondly, also understand the child is getting into a routine which is for their comfort. So please do not disturb their routine. And I hope it helps you to understand that it will be very, very helpful if you let your child be by themselves. I hope this mother is not going to be worried. Hi, my next question is, how much water should I drink after a C section? First of all, congratulations, mom. You are doing a wonderful job and you have welcomed yourself with a baby, and your journey to motherhood just started. Whether it's a C section delivery or a normal delivery, you have to be hydrated. That is the key. Third thing you have to understand is that when you are talking about your normal about having water, you need to drink at least 3 to 4 liters because your baby is dependent upon you. Now, hydration it involves buttermilk, lemonades, juices, fresh fruit juices, having coconut water, regular water, infused water, chia seeds water, sabja water. These are the different varieties of water which you can have on a regular basis in these 3 to 4 liters. Now, if you're a coffee lover, if you're a tea lover, I would just suggest you that stay away from all these things, because caffeine is something which may have a harmful effect on the body and makes your body a little dehydrated. So have plain milk, chas, which is good for your health, and definitely you will be hydrated and you will be back with all the energy and the enthusiasm which is required for the working of yourself. My next question is, I am having a period like pain in the stomach and my back pain too. I have a lot of white discharge from last 1 week. Does this mean that I am in labor or my labor is going to start? My doctor has still given me 15 days for delivery. Please help. Well, mom, it seems like you are almost getting into a mode of labor. Creamy white discharge could be that your water has started breaking. Abdominal cramps or back pains in spasms, like just like a few seconds, they would be coming from the back and into the forward, is an indication of early labor. I would just suggest that you go and visit a doctor at the earliest. Speak to them about the symptoms that you're facing. Even though you are 15 days, away from your delivery, it could be natural that you might deliver in a day or two. So, get your hospital bag ready. Ensure you have all the essentials with you. You are well prepared with your family members around you whom you're looking forward for. And with an open arm, welcome your first child into this world for joy and happiness. We wish you all the best and have a safe delivery. This was a very beautiful question. I mean, when you are getting into labor, you don't really understand what is happening. So, what we have to understand is the movements of the baby, that is the kicks, the pains that the mother experiences, sometimes nausea, vomiting, sometimes just a delusion effect, like everything is come to a stop, everything is standstill, we don't really understand what is happening, and at that point of time you might start experiencing labor. So these are something which we have to always be watchful about. Another question for the day is, मेरा बेबी बहुत रोता है, शाम को मैं बहुत परेशान होती हूँ, प्लीज कुछ उपाय दीजिए. Now, this is a very tricky question because the mother has mentioned that the baby only cries in the evening. तो फर्स्ट ऑफ ऑल, बेबी शाम को क्यों रोता है या बेबी का रोना बहुत ज़्यादा टाइम पे होता है, हमको ये समझना चाहिए कि बेबी की पेट की हालत कैसी है. जब हम लोग फीडिंग कर रहे हैं, जब हम लोग बात कर रहे हैं, फीडिंग कर रहे हैं, उसके साथ साथ ये भी देख रहे हैं कि उसके फीडिंग प्रॉपर है या नहीं, इसलिए उसका पेट भरा है या नहीं, पेट भर रहा है या नहीं, ये और वो सिर्फ दूध ले रहा है या हवा ले रहा है, इसके कारण हमें ये जानना बहुत ज़रूरी है उसका प्रॉपर लैच है और उसका प्रॉपर टाइम है या नहीं. और कोलिक बोलते हैं, शाम के वक्त जब बच्चा रोता है उसको कोलिक बोलते हैं. उसके लिए डॉक्टर आपको कोलिक पेन रिलीफ देते हैं, जो ये दवाई आप उसको दे सकते हो. या तो फिर बच्चे के पेट में बहुत ज़्यादा गैसेस हो चुके हैं, आपने कुछ ऐसे खाया होगा जिसके कारण बच्चे को गैसेस की तकलीफ हो रही है, या तो फिर बच्चा सिर्फ हवा ले रहा है और दूध नहीं ले रहा है. ये 3 चीज़ों की संभावना है जिसके कारण बच्चा रोता है. बेबी चक्र के पास टम्मी कोलिक रिलीफ का एक आसान रोल ऑन है जो आप इस्तेमाल कर सकते हो. वो बेबी के नाभि के नीचे उसको रोल करना है और इसका इस्तेमाल करके आपके बच्चे को सुकून ज़रूर मिलेगा. ज़रूर ट्राई कीजिए और इसके बारे में हमको सही सही बता सकते हो आपका रिव्यू देके. And with this, we come to the last question for the day, is that I've had a C section 1 month back. When should I start wearing a belt to reduce my tummy? Now, Once you have to understand that wearing a belt after C-section is going to give you a mental comfort and not a physical comfort. Because we have to understand after C-section, when your stitches are open internally and externally, it takes at least 3 months time to heal. So there could be a chance of infection due to sweat, due to itching, or due to extreme dryness. When you're putting a belt around your tummy, we also have to understand that this is going to cause an obstruction. It is not going to help to reduce your weight. It is just going to give you a support for your back and your stomach. Ideally, we should avoid using all these things, but if someone is really insisting on it, I would suggest go after 3 months when your internal stitches are healed, when your external stitches are healed, and you are all well and sorted for having a good comeback. These were the questions that I have taken up for today. We will be meeting again tomorrow from 10:30 to 11 with the new questions, and I hope you are enjoying your our Baby Chakra app. And definitely I can see a lot many questions which as experts which we are trying to address to the queries in a given time. Thank you and keep using Baby Chakra.